Halifax was always a place in my mind of caring, and we were here to take care of sick folks.
For the last 80 years, it's been a grounding force of heritage, achievement, and perseverance.
There really is a commitment to this community and the ability to see patients, whether they're uninsured or underinsured.
When I came here, there were 3 hospitals, but Halifax was the largest, the most comprehensive, the most full service, and it was the hospital.
It's hard to deny what Halifax Health has meant to the community.
It survived the Depression, it has thrived, it has transformed itself several times. It served as a hospital to war veterans. It has grown immensely over that period of time, and it continues to be a leader in healthcare in our region.
In the late 1920s, just before the dawn of the Great Depression, healthcare in the United States was in a state of inadequacy.
Well, 1928 was really a turning point in this country. Of course, you all know the early 20s and the middle 20s where America and Florida itself were enjoying the greatest economic boom we'd ever seen. A bunch of citizens got together, mainly from the Daytona Beach Rotary in 1925, and had enabling legislation passed that allowed the Board of Commissioners to tax the local population. And a bond issue was raised for $750,000. Construction was started.
Halifax Hospital, of course, was built in 1928. It's a beautiful structure. Not much is left today, but they did preserve part of it, and you can see the first facade part as you look at it today from the front. It was Mediterranean revival architecture, stucco, and had red tile. It's a beautiful structure.
20 physicians and 4 dentists made up the original staff in its first year of operation.
We were miles ahead of everybody in technology and the community. The sad part is that a lot of this community never realized and still don't realize what they have out here. We have a medical center, not a hospital, or a medical center.
It was a real grand dame of its time, and it was reflective of the opulence of the years of the 20s. A year before the Great Depression, the real estate land boom in Florida crashed, and the major banks in town closed, and by the time the Depression hit, we had already been there.
The unemployment rate in the community caused many people to be unable to pay for health care.
My dad talked about my grandfather practicing dentistry during the Depression era, and it was commonplace to do free dental care or to be paid with a chicken or a ham or eggs or whatever somebody had at that time. That was the bartering of that day when financial times were really tough.
In 1942, the U.S. Army rented or leased the Halifax Hospital from the county.
During World War II, we had the wax stationed here. So this hospital moved to a hotel on South Atlantic.
Mary McLeod Bethune, one of the great educators of the United States, was instrumental in making this happen.
One of the things that Mary McLeod Bethune did is she was very friendly with Eleanor Roosevelt. And at that time, they were trying to develop an idea that women could train for the armed services.
In the late 40s, the Women's Auxiliary Army Corps Training Center was moved out of Daytona Beach, while the government continued to lease the property, operating it as the Welch Convalescent Hospital for the U.S. Army.
This was filled for rehabilitation of several of the soldiers that came back from the war.
Convalescent Center was named after Army surgeon William Welch, and he was well known in World War I. He was a surgeon, pathologist, and a medical writer, and it was appropriate that this convalescent center be named after it.
All the streets surrounding the hospital are Hilton, Jabali, Willis, Heinemann. They're all named after Daytona Beach World War II vets who were killed. And centered around Jabali was where the POW camp was, and it was there for a little over a year and a half. The people there, they got along. They would actually go out and work in the town and come back, and were treated quite well. And a lot of them wound up staying in this area afterwards and not going back after the end of the war.
Right after World War II, a group of very fine physicians decided to settle here in Daytona Beach, and they brought others with them. Then they would tell their friends about it, and so we have always been blessed by top-notch medical people.
In January of 1947, the hospital was returned to the county, and it was restaffed with medical people. It was needed to start our hospital again.
The 50s and 60s saw continuous expansion efforts, including a 3-story northeast wing, as well as an orthopedic center. Halifax was in a state of constant bloom and progression.
In fact, if you look on our campus now, you'll find a building from every decade since 1928.
I've seen a lot of changes. People come, people go, people come back. And what really interests me is I've been here 30 years and all the new buildings that have come.
It was 4 stories when I first got here, and it has grown pretty much, so I feel comfortable, I feel a part of it.
Halifax has always prided itself on staying at the forefront of technology in patient care, which was reinforced in 1984 when Halifax opened its 42,000 square foot regional oncology center.
The interest was in developing a modern, up-to-date medical complex. We tried to develop this center to encompass all of the areas of involvement in cancer care, and we were eminently successful in doing that.
Halifax has already established itself with areas of excellence. They're known for care and cardiac care, emergency room, orthopedics.
When it was built, though, it was in all the journals as the top technological marvel in the entire South of the United States.
I think we have a strong interest in, and we're making progress in minimally invasive surgery, which has the advantages of more rapid recovery, less complications. We have the new robotic system that's another avenue for minimally invasive surgery, which is still relatively novel, and it certainly keeps us competitive or gives us an upper edge with respect to what we can offer patients.
Technology is a wonderful tool, but it's just that, it's a tool. It requires skill and ability and compassion to be able to take that tool and use it effectively, particularly when it comes to delivering care.
The robotic technology that we've become invested in the last year, both the gynecologists, the urologists, and now cardiovascular surgeons are all becoming very adept at that. That offers the next level of the minimally invasive surgery.
I've been deeply involved in the development of the hospital, and I've seen it change. I've seen it change from a provincial hospital into a major medical center for this area.
And I love the idea that we're expanding to various areas of the community. I mean, now we have Port Orange, we have Ormond Beach, and of course we have right here Daytona. And I love the fact that we are right here in the center of Daytona.
Probably the proudest moment that I've had in the time frame that I have been here was when we broke ground on our new 10-story tower in our emergency room.
The new tower will give Halifax Health a combined 944 beds, private patient rooms, and the largest emergency department in the state of Florida.
I've seen a lot of change, and I'm really impressed with the fact that Halifax Health is going to expand to serve the area, because there are so many needs and things that Halifax Health Center can provide. And I've been very impressed over the years with what they've done.
The past is any prologue to the future, as the philosophers say it is, then Halifax will be right in the forefront and do whatever is required to have the technology and the personnel and the training to satisfy the needs of the citizens of Volusia County.
Halifax is a unique institution because it's owned by the community.
Well, they are a significant part of the community. They carry their share of the load. They don't go through the door on the other guy's push.
Because we are here for a purpose, and the purpose is the patient.
Graduated from Tulane Medical School and finished my 15 years of training from high school till I came back here. There wasn't any doubt where I was going to go, Daytona Beach. This was home, and this hospital has been part of my life ever since.
Halifax being an icon in the community, I can't think of a single entity or organization that has been more important than Halifax Health to the community.
We have many physicians who work together and seem to share a bond that we are all there to serve the community, to work with each other, and to try and deliver the best care possible.
Every October, everyone that's in that 100 Club look forward to that day, because we get together and it's like looking around like a reunion. You know, and we're all there, and there's some that has gone that left us, and then there's still a lot that's here. But just to see those faces, is such a joy.
is the nurse in 1929, when I was born, was Mrs. Dudley. She put a little blue rib in my hair, I'm told, and brought me out. 30 years later, when this guy was born, Mrs. Dudley, the same nurse, brought him out to me. She had been here for 30 years as a faithful employee of Halifax Health.